Hello, welcome to Healthy Kingston. This is a program of the Board of Health of Kingston, Massachusetts, and I'm Janet Wade, your host. I would like to start our program today with Leanne McGuinness, who's our public health nurse, who will give us an update as to the health status of the residents in Kingston. So Leanne, take it away.
Thank you, Janet. Thank you for allowing me to be here again. My name is Leanne McGuinness. I am the public health nurse for the town of Kingston. I'm just giving you the monthly report. We currently have an uptick of COVID cases. We currently have 54 reported cases. That has increased since last month. Again, those are just reported cases. We have an abundance amount of COVID tests. If anyone's looking for at-home antigen tests, you can reach out to the Kingston Board of Health. You can reach out to myself, and we can help assist you with access to the COVID antigen tests. I did just want to touch base. As you know, I will usually refer you guys to either our Kingston Board of Health website or our local social media, whether it was Facebook or Instagram. Currently keeping it up to date on trends and things that are going on within our community, recalls on safety products. Currently on the South Shore, we have seen a rise in mental health. So really just want to stress that if you're struggling, mental health is real. We really want to smash the stigma of mental health. This is very important. We want to bring awareness that you're not alone. And if you're having thoughts of suicide or suicidal ideations, thought of harming yourself or somebody else, please don't hesitate. You are not alone. The resources that we are constantly posting are hotlines. The current lifeline that we are utilizing is 988. If you need any 24/7 emotional support, I highly suggest that's the resource that we utilize. And if you need any help, please don't hesitate to reach out. Janet, again, thank you for allowing me to be here. Just want to let everyone know we do have a vaccine clinic coming up February 15th at the Council on Aging. That's 30 Evergreen Street. In Kingston. It'll be 5 to 7 p.m. walk-ins. If you need help registering, we'll help you do that. If you have difficulty accessing the computer, we can help you get you registered and all set up and ready to go. Again, if you have any questions, don't hesitate to reach out to the Kingston Local Board of Health Department. My name is Leanne McGuinness. Janet, thank you for allowing me to be here, and I can't wait to hear Sarah.
Thanks, Leanne. I appreciate it. So the focus of today's program is going to be coping with mental illness. And as Leanne had mentioned, there's been a tremendous concern as far as mental health issues, particularly in our area in Southern Massachusetts. Particularly as of late, there have been a number of suicides and mental illness overtures. So we felt that it would be important to address that today. With that said, mental health involves our effective functioning every day. It's how we practice productive activities such as going to work, going to school, being caregivers, having healthy relationships, and being able to adapt to any adversities that come our way. Unfortunately, mental illness is alive and well, not only locally, but nationally and globally. Globally, about 8% of the population is affected with different types of mental illness. Across our country, 1 in 5 people, or approximately 19% of the population, is affected with mental illness concerns. And probably 3/4 of these come to light by the time the person is about 24 years of age. So it is definitely something that is plaguing our population, particularly with all the stress and the chaos that we've been going through over the last 3 years. So with that said, I wanted to go to the experts in our area, and I've asked Sarah Cloud, who was the director of social work at Beth Israel Deaconess Hospital in Plymouth, to speak with us not only about mental illness and how to cope with it, but what families can do and friends of who are concerned about people who are suffering from mental illness, how to identify it, and then also where to go for help, for resources. So Sarah, thank you so much for being with us. Really appreciate it.
Thank you for having me, Janet.
Absolutely. So what are you seeing from a professional perspective? Who are you and fellow counselors seeing? And what are the issues seem to be as of late?
Yeah, so that's a really great question. And I think for all of the reasons you've outlined already, we're really seeing an increase of really all ages seeking treatment. And it's largely, I think, mental health issues and substance use disorders were alive and well prior to the pandemic, but the pandemic and particularly the stress, the uncertainty, and really the isolation has really made things so much more difficult for people to cope effectively and to stay connected. Isolation has been particularly difficult for people that were already living with depression and substance use disorders, because that isolation, the depression and substance use really just feeds on the isolation. And then we add that in combination with the stigma, and the stigma is really what stops us from stops anyone from reaching out and talking about what's going on and getting help. So it's really the stigma that's lethal.
Exactly.
The mental health itself is very, very treatable. The substance use disorders are very treatable, and that's why it's so important for us to be having these conversations. So thank you so much for for casting light on this topic.
Absolutely. And the fact that, and I'm sure the two of you would agree with me, mental health concerns are across the spectrum. So regardless of your gender, your sexuality, your socioeconomic group, your geography, your racial background, your culture, it's present everywhere, and it's a concern for all of us. It goes across spectrums, and it does not select certain groups of people, that's for sure. Sarah, what should we all be looking for in our loved ones, people we work with, people we socialize with, that we know that might be red flags that maybe this person needs help or is seeking help, wants help?
So that's a really great question. There are behavioral and cognitive changes that can be indications to watch out for in people around us and people we love, people we work with, people in the community. So some of those behavioral changes to watch for is changes in sleep, either sleeping too much, difficulty getting out of bed, sleeping too little. Insomnia, I think, is a very, very concerning health crisis that leads to very concerning mental health crisis. Constant feelings of fatigue that might be unexplainable. So they've had medical testing and they just can't find the cause of what's causing this fatigue. Longer bouts of deep sadness. We also see irritability or changes in mood as being signs to watch out for. Withdrawing from social activities. So isolating, again, is something that we need to be very careful and watch for. In other types of mental health or mental illnesses or diseases, there's an onset of paranoia or increased anxiety. And I think, we already talked a little bit about the intense mood changes. And then there's, I know we talked a little bit about suicide prevention already and those signs, but I think it's important that we also share the signs of somebody who may be thinking about suicide. And those two things to watch for are people talking about wanting to die, or, just talking about suicide. They're talking about feelings of feeling empty, hopeless, or not having reason to live. We talk about great guilt or shame, feeling trapped as if there's no other solutions, unbearable pain, emotional or physical pain, talking about being a burden to others. The other things we need to watch for is use of alcohol or substances to self-medicate. And we've, again, talking about withdrawing from family and friends are all really important things for us to really keep an eye out for.
Hearing the symptoms that you're coming up with and the signs, are there any of them that are, would you say, are specific to an age group, like adolescents versus middle age versus seniors, or they across the board?
They really, they can, it's a good question. It really is across the board. I think the watching particular with youth around changes in eating and sleeping is important. And their anxiety and the social withdrawal is withdrawing is also incredibly important.
And yes.
And also there are times where in retrospect, we might look back and we didn't see those signs. It's good to know what they are. It's good to be educated. It's good to be aware and be reaching out, but that is sometimes the extent of what we are able to do for others.
Well, and that's the next area of concern, particularly for people who are not mental health specialists.
Yeah.
How do you reach out? What do you say? How do you even begin the conversation?
So if you're concerned about somebody, and I think it's really important to take the time to be compassionate and set up, whenever possible, a private, compassionate place to have a discussion with them and let them know what your concerns are and what you're observing. I think it's sometimes really helpful to be concrete. If you're seeing specific things or behavior changes, they might feel less attacked. They might feel more supported. If I notice that, you're having a hard time getting into work on time, are you having a hard time getting out of bed? Asking questions like that, normalizing the symptoms that you're seeing, the behaviors that you're seeing is often sometimes indication of somebody having a really difficult time, and we care about you. And that's why we want to have this conversation. How can we help?
Okay. And then with that said, what recourse do people have? I know I've been in a number of groups in Kingston, and parents are so frustrated and they're like, I don't know where to go. I don't know where to turn. What do I do?
Yeah, it's a really good question. I think so. In the moment, really monitoring and keeping an eye. And if you have concerns about somebody's safety, if you think they might be having thoughts of suicide, if they're telling you they're having thoughts of suicide, it's really important to stay with them, to keep them safe, to remove anything in your area that you're aware of or in the environment that might could potentially be used to harm themselves. It's important if having an emergency like that to reach out immediately, call for help, get the person to the nearest emergency room if at all possible. Just like a medical illness, we really need to be thinking about mental health and substance use and talking about mental health and substance use as the medical disorders that they are. So, if you were having strep throat or, sore throat, you'd go to urgent care, right? Or you'd call your doctor. So if you're starting to feel, depressed or, difficult sleeping, go to urgent care. There's mental health urgent cares now, and I'll talk about that in a moment. Or call your primary care. Medically, if you were having chest pains, you go to the emergency room. Like, we need to be thinking about the signs and symptoms of mental health and substance use disorders in the same way that we are medical. So in that case, if you're having thoughts of harming yourself, harming somebody else, severely depressed, unable to function, get to the emergency room. So those are, we need to think about it, and I think in very similar ways.
You're right. I mean, what you said is there's less of a stigma about it now, that people are a lot more open, I think, to what they're experiencing, what they're feeling, and it's important to share those with the people around you, so they can reach out and help you.
Yeah.
You mentioned the emergency room as a resource. What are some other potential resources people could use?
Yeah, certainly. I mean, going to the emergency room can be a really long wait and it's not always necessarily most therapeutic, but it is life-saving. So if it is a mental health emergency, please come in and seek help. We are here for you. There are many other avenues as well that I think are really important for us to be talking about. So the three primary things I'd love to talk, or resources I'd love to talk to you about here today, is calling the primary care office, the 988 Lifeline, and the community behavioral health centers. So kind of breaking that down a little bit. If you're connected with a primary care office, many primary care offices and health centers absolutely recognize that your mental health is part of your overall physical health and well-being. And many have either embedded behavioral health specialists, so therapists, psychiatrists, nurse practitioners into their practices, or have a referral source, a relationship with practices that they can refer you to. So they're a really, really great resource to go to. They're also really busy, with COVID and the flu season and everything else. So I want to make sure that you have more additional resources to go to as well. So the 988 Lifeline was launched in July of last year. I know Leanne has posted that to your the Kingston website and on social media a number of times, but that's an incredibly important resource. So 988 offers 24/7 access to trained crisis clinicians who can help people experiencing mental health related distress. So this could be thoughts of suicide, it could be mental health or a substance use crisis, or other kinds of emotional distress. So what's the really nice piece about this is I think it's really designed to have options for all ages. So people can call, people can text 988, or they can go to the website and do a chat. And the chat is 988lifeline.org. And they can call either for themselves, or they can call for somebody that they might be concerned about and get some guidance and direction. So that's an incredibly important kind of universal entry point, that no matter where you live in the United States, you can reach out 24 hours a day and be connected with a trained crisis counselor that can help.
That's tremendous. I didn't realize you could text or you could email. That's
Yeah,
wonderful.
I mean, the younger kids, the younger age group is prefer to text and prefer to chat. So I think it's
Right.
really important that we have it available and all those different types of mediums. So the other incredibly important resource that launched January 3rd, so earlier this month across the entire Commonwealth of Massachusetts, are community behavioral health centers. And the best way for me to describe them as they're urgent care for behavioral health. So they're urgent care centers for mental health and substance use crises. And so there's 25 across the Commonwealth. Our local one here in the Plymouth, Kingston area is at 41 Industrial Park Road in Plymouth. And so what the community behavioral health centers, or they're called CBHCs, provide, both in person and via telehealth, are same day evaluations and access to treatment with timely follow-up appointments. Again, mental health and substance use. They have evening and weekend hours. And they offer evidence-based treatment for the whole spectrum and range of behavioral health. There's also a 24-hour hotline available for folks to call as well. So down here in Plymouth, at the urgent care center, the community behavioral health center, they're open Monday through Friday for walk-ins, 8 a.m. to 8 p.m. and Saturdays and Sundays, 9 a.m. to 5 p.m. They see all ages.
Wow.
So they can also call and make an appointment, but again, walk-ins are a really important aspect of the care that they're providing. And so the phone number, so this is a partnership locally here in Plymouth between High Point Treatment Center and Child and Family Services. And the phone number for Child and Family Services, again, is 24 hours a day, is 508-996-3154. So this is an alternative, just like urgent care for medical reasons is an alternative to the emergency room. this is an alternative for behavioral health, mental health, and substance use from the emergency room. But again, if you're experiencing a crisis, please make sure that you're getting the help you need coming to the emergency room, and making sure that you are safe and taken care of.
So we've given us a lot of information. You've talked about symptoms. You've talked about what to look for, how caregivers should approach people of concern. You've given us some resources. So what would you say, what are the major takeaways you want people to have from this discussion?
The major takeaways I'd like you to have, folks to have in our community, the number one piece is you're not alone. There is help out there, and we want to make sure that we are connecting you with where to go. I think there's also a tremendous amount of stigma and shame. And if people just pulled themselves up by their bootstraps, they could, get themselves out of this. That is the number one myth, and it's incorrect. It is mental health and mental illness is a real mental medical disorder, and it is treatable just like any other medical disorders. And the earlier you intervene and get help, the more treatable it is. Very much like, if you have diabetes or, heart disease, again, the more proactive and the earlier you catch it and the more treatment you get up front, the prognosis is going to be better as well. And people suffer needlessly because of the stigma. And I think that's a tremendous shame. So I really want people to know they don't have to suffer, they can feel better, and there are resources available to them.
Well, on that note, tremendous words of wisdom. Thank you so much.
Yeah.
We care about you as a community. We care about, as parents, as residents, as neighbors. We care about all of our residents and really do hope that you will take Sarah's advice very, very seriously. And we will have the numbers on the screen. And again, as Leanne and Sarah mentioned, they're also on the Board of Health website. So with that, Sarah, Leanne, thank you so much for your time. We really appreciate it. Take care and stay healthy.
Thank you.